other thing I would like to touch on is medications, right? So a lot of us, the moment we were positive, there are a lot of medication lists circulating in social media. Once you're positive, start taking these medications. So I thought I'll just share my thoughts on what relevant medications one should consume. So I mean, we advise patients to take a multivitamin that contains zinc and selenium, if possible. Vitamin C, right? So 500 milligrams twice a day is very good to boost your immune system. Vitamin D, there's increasing evidence to show that if your vitamin D levels are optimal, your immune system works much better in terms of fighting and warding off the virus, and it has shown to reduce the risk of complications and in terms of disease severity. So vitamin D levels, I mean, some of us may have not tested our vitamin D levels previously, but a lot of us tend to have the vitamin D levels in the insufficiency or deficiency range, right? So what we normally recommend is, I mean, if you look at the vitamin D, the spectrum, normally it's 30 to 100 is considered the normal range. But evidence shows that if you have a level of more than 50, then your risk of fighting the disease or other complications arising from the disease is much less, and it really boosts your immune system. So we would recommend at least around 5,000 units, 2,000 to 5,000 units for about 2 weeks during the acute phase of the infection, right? Now, in addition to that, the doctor may prescribe supportive management options or medications such as paracetamol, and some people or Rapidine or Panadine, which is paracetamol, and codeine for your fever, body aches and headaches. We generally advise patients not to take any other painkillers, especially those belonging to the non-steroidal anti-inflammatory group, right? And there'll be other medications that we prescribe based on the individual symptoms, right? I would like to highlight about azithromycin, because I see a lot of patients who have been tested positive, and they feel, and I know that there are a lot of social media circulars that say, okay, as soon as you're positive, on day one itself start azithromycin. Now, azithromycin is an antibiotic, right? Based on current evidence, I think there's a paucity of evidence to show that if you start azithromycin on day one of your infection, it doesn't reduce the disease severity, it doesn't reduce your complication risks or in terms of your mortality, right? So I mean, there are a lot of studies that are ongoing now, which may later on show us in terms of whether it really works or not. But don't get me wrong, azithromycin, certain doctors do prescribe it during different stages of the illness. But what I'm talking about is starting azithromycin the moment you turn positive on day one, right? So it's important to practice evidence-based medicine, and what this will lead to is a huge issue in terms of antibiotic resistance, right? And that's something that, because if you just imagine every COVID positive patient being prescribed azithromycin, and we really are going to have a huge issue in terms of antibiotic resistance in the future. So before just starting the antibiotic, it's always good to kind of do it in consultation with your doctor, and your physician will then advise you whether you need it or not.